sense of what you're seeing in terms of demand, given that quite a number of countries are now seeing a second and third wave of the virus?
Thank you, Haslinda. In fact, demand has been very strong. There has been an upsurge of demand from every part of the world. This is something rather unusual. In the past, we have demand coming from specific countries, but right now we are having requests for gloves in almost every corner of the world. And we're working very hard to get the gloves out so that they could reach to the end users very quickly in the hospitals, in laboratories, and many other places where they are required very badly.
Can you quantify that increase in demand? Also, you're talking about how demand is coming from everywhere. So far, the U.S. has been quite a major market. You've seen, what, 25% of your sales coming out of the U.S. Will that change, or are other countries likely to take over?
This will continue because from historical data, the U.S. has always been a very important market for big glove manufacturers like Top Glove. And the demand, in fact, is the biggest in the world on a single country basis. If you look at before the pandemic, the demand for gloves used to be about 8 to 12%. Right now, we are seeing the demand increasing from 10, 15, or even 20%. And particularly in bigger countries where the concern for health and protection is much more important. The demand has even increased by hundreds of percent. Like in the US, if you look at the past few months, it has increased by about 250%. And in Europe, some countries have increased by 300%. And even in the Far East, in countries like Japan, demand has also increased by about 300%.
There is talk now that we could see a vaccine by 2021. How might that impact demand for gloves? And what kind of decline are you anticipating or not?
We are happy to hear that a vaccine is in view. And we hope that there will be success in the vaccine so that to alleviate the sufferings of many people in the world. Looking at the vaccine, we believe that it will take quite some time. And it is something that requires to be manufactured very quickly and supplied to many countries in the world. So moving forward, we believe that the demand for gloves will still be strong because if you look at in terms of counteracting the pandemic, the two most important items are basically face masks, gloves, hand sanitizers, and etc. So once a person has come into contact with gloves, we believe that the awareness is created and they will continue to use gloves even post COVID-19 pandemic. And there are a lot of smaller countries where in the past, they have allocated a smaller amount to hygiene, smaller amount to public health. We believe that this COVID-19 pandemic has raised the awareness of many, many people in the world to the level where they believe that it's important to practice good hygiene and important to take good care to protect themselves.
Dr. Lee, how much protection do gloves actually give you? I've asked the question, I mean, there are very many obvious answers, but one major one is that people touch their faces. And if you're wearing a glove or if you're not, you still touch your face. And that's one way that you can have transmission.
Yes, but at least there is a front line of protection. We always say that gloves help us to protect against lives and also protect against harm. And if you look at the usage of gloves, it has been around for more than 100 years. And gloves have been manufactured differently in the past than compared to now. And right now, if you look at advanced countries like America, Europe, the number of glove usage has increased tremendously to the extent of each person in America, for instance, use at least 150 pieces of gloves on a per capita population basis, compared to in the Far East, where some countries on a per capita basis, they only use about 5 pieces of gloves. So gloves, I think, are relevant in many, many areas. The ones that we are most familiar would be the examination gloves, where they are used to for short period contact with the patients, for the nurses to handle chemicals, for the lab technicians to handle testing equipments and etc. So look at it, it's like a second layer of skin where with the gloves on your hands, at least you are not in contact with dangerous substance. And by dangerous substance, I mean it could be bacteria, it could be viruses, and it could be other harmful chemicals. So looking at it is very natural in countries like America, where glove usage is very common. They use it in the office, they use it in the hospitals, they use it at home, and even some of them have a box of gloves even in their cars, so that at any one point in time, if they require it, it could be put into good use.
Utterly, the other question is, with this huge upsurge in demand for gloves, they've been minting billionaires here, but there's still concerns over wages and working conditions in your company. Are you paying your workers properly now, and are you ensuring that perhaps they share in this boom too?
Yes, a very good question, Riz. In fact, the issue that you mentioned about the treatment of foreign workers, we have a better awareness of it in the month of December 2018, when the news broke out that Top Glove, the biggest glove manufacturer in the world, has issues with working of overtime and rest days per week, handling of passports and etc. In fact, we were glad that we were given the opportunity to improve at that time, and because before that, a lot of these issues are not specifically made known, and we have the opportunity to know more about these requirements. And since then, from January 2019 till now, we have improved by leaps and bounds. If you look at it, we have done so many things. We even have come up with the best practices, like we give 2 lockers to our employees. So we could tell them that you have the choice to either keep your passport in your personal locker in the place where you stay, or you have the choice to keep it in the office where the passports are under CCTVs and a proper place to keep it. So many other such practices have come in. And why did the news broke out about Top Glove at the time? I believe was because we are the biggest glove manufacturer in the world. And a lot of news when they broke out, they always like to choose the biggest in the industry. And mind you, this has always been an industry problem, and also a problem in many developing countries, whereby they are still trying to learn what is the best way to move forward, what is the best way to handle foreign workers. And if you look at Top Glove, we have a total of 12,000 foreign workers. So if you talk about 1% of them, if they have any issues, we are talking about 1,000, 100 and 200, 120 foreign workers. I think we are glad that in Top Glove, we have also practiced a very good culture. Our culture has always been talking about integrity, and our culture has always been talking about good health. We have embarked on this good health journey more than 10 years ago. And by good health, what I meant is that we pay a lot of attention to ensure that our workers live in a hygienic place. We ensure that they are given proper meals. We ensure that they are well protected. We ensure that they have a good place to stay, and etc. And we also established a medical center. I believe we could be the first in the industry to have such a program to invest in a medical center where we have 9 nutritionists and we have 3 doctors. We have a dentist.
Dr. Lee?
Yes.
Dr. Lee, have you solved your dispute with the United States where some of your products were banned?
We are talking to the CBP, RIS. In fact, they are very responsive and very professional. We started our conversation on July the 17th. And last week, we spoke to them as well. And this week, we are continuing our engagement with them. And we are pleased to have the opportunity for the CBP to hear the other side of Top Glove. And we have also taken measures to tell the CBP that we want to do good. We have the best of intentions to improve, and we want to do it properly this time. And the COVID-19 has afforded us the opportunity to do it well. And one of the things we have done immediately, was we made our first remediation payment yesterday, 10th of August. We paid out a total of ringgit Malaysia 4.5 million, or roughly about US 1 million, as the first phase of our payment to the foreign workers towards remediation of their past debts. I should say that this is something that is not practiced by everyone in the industry. But again, since this is an important issue that we have not resolved yet, we want to do good. We want to do good and we want to do well in this area. I think the other issues like passports over time, rest days have all been resolved. And other than remediation issue, other issue is basically looking at the welfare of the workers, which at the moment we are coming up with programs to improve in this area as well.
Mr. Lee?
Yes, Haslinda?
Mr. Lee, just very quickly, the glove industry has minted quite a number of billionaires. Is there any indication that perhaps the government will impose some windfall tax on the glove industry?
We believe the government will be able to differentiate that the windfall tax in the commodities sector is different. Because in the commodity sector, they are basically exporting the products on a raw basis, whereas in the case of the glove industry, they are looking at value-added product, which I think is important for Malaysia to continue to emphasize in this area, to produce more value-added products so as to bring in more foreign exchange for the country.